The chair now recognizes herself for 5 minutes for an opening statement. This morning's hearing is to examine the trends and research into long COVID, the chronic syndrome occurring in patients infected by COVID-19. This is the first congressional hearing focused on this issue. The few large formal studies conducted on long COVID hint at an alarming scale of people with the illness. Last week, CDC published a study finding that among adults with COVID who did not require a hospital stay, 2 out of 3 had at least one outpatient visit 1 to 6 months after diagnosis. People with long COVID report experiencing different combinations of symptoms, including fatigue, brain fog, headache, loss of smell or taste, shortness of breath, and chronic pain. Since this disease affects multiple body systems, the symptoms can be much more extensive. This research suggests that in the United States, where there have been more than 32 million confirmed COVID-19 cases, there could be millions of long haulers with chronic symptoms. Our health system is facing an avalanche of long COVID patients, and I hear every day from constituents suffering from the long-term effects of the virus. Our expert witnesses today will provide the latest information on the lingering effects of COVID-19 and the limited options for treatment. We'll also hear firsthand from long-haul patients. They will provide a perspective that we wouldn't get from statistics and medical studies. So we're very grateful to them for their willingness to share their experience with us. And certainly they will underscore the human cost of long COVID. Long COVID patients don't fit the common narrative of COVID-19. A patient being an elderly person, for example, with pre-existing conditions. And they cover really right across our communities. They are elite athletes, they're mid-career professionals, and because of this, many long haulers struggle to be taken seriously by our medical system, especially, and here we go again, especially Black women and women of color. My fear is that as acute COVID uncovered our nation's failures at emergency response and equitable health care, long COVID will uncover our failures at fairly treating chronic disease and disability. For sure, federal leadership is going to be needed to coordinate and address the swell of the long haul COVID patients. We may need a nationwide network of long COVID clinics with multidisciplinary clinical teams. Long COVID patients are also finding gaps that need to be filled in our safety net, such as disability insurance, workplace accommodations, and comprehensive insurance coverage. There is hope on the horizon, though, having stated all the things that I have. In the next few days, the NIH will announce millions of dollars in grant funding for long COVID researchers. Also, with every American adult now eligible for the COVID-19 vaccine, we will prevent future long COVID cases, and in some cases, perhaps reduce long COVID patient symptoms. These patients are showing us how to rebuild a better health system for the millions of Americans who are disabled or have chronic conditions.